Question 1. In the context of vascular anatomy and hemodynamics, consider a patient who is undergoing a catheter-directed thrombolysis procedure for a large deep vein thrombus (DVT) in the femoral vein. The interventional radiologist must take into account the hemodynamic factors involved, such as blood flow velocity and vein wall compliance, to optimize the procedure. What is the most critical consideration for selecting the proper catheter? Thrombolysis in this situation: A. The catheter must be small enough to navigate the femoral vein. B. The catheter's tip should have an aggressive power for better thrombolysis. C. The catheter must have a balloon for balloon-assisted thrombectomy. D. The catheter's design should ensure minimal disruption of normal blood flow. Answer. Correct answer, D. Explanation. The most critical consideration in catheter selection is ensuring that the catheter design minimizes disruption of normal blood flow while facilitating effective thrombolysis. This is particularly important in a scenario involving DVT, as preserving the integrity of blood flow in the femoral vein is paramount for reducing further complications such as post-thrombotic syndrome. The catheter must also allow for safe, effective drug delivery and clot fragmentation, which involves balancing its size, flexibility, and maneuverability. Question 2. Given the circumstances of a patient presenting with a ruptured arteriovenous malformation AVM in the brain, an interventional radiologist must assess the risk of hemorrhage and the complexity of embolization. What is the key factor in choosing the embolization material for this procedure? A. The embolization material must be fully absorbable over time. B. The embolization material must induce permanent occlusion of the abnormal vessel. C. The embolization material must be radiopaque for easier identification. D. The embolization material must be compatible with anticoagulants to prevent clotting. Answer. Correct answer, B. Explanation. The most critical aspect of embolization material selection in the case of an AVM is its ability to induce permanent vessel occlusion. The goal is to stop the abnormal blood flow, preventing further hemorrhagic events. Materials like liquid embolics, e.g., onyx or ethylene vinyl alcohol copolymer, are often chosen because they provide durable occlusion, reducing the risk of recurrence. Radiopacity is important for visualization, but permanence of occlusion is the key consideration in this high-risk scenario. Question 3. Considering the evidence on radiation safety in interventional radiology, what is the most effective strategy for minimizing radiation exposure to the patient during a complex angiography procedure? A. Reducing the fluoroscopy time as much as possible. B. Using a higher energy setting to penetrate tissues more efficiently. And C. Increasing the distance between the patient and the X-ray source. D. Administering sedatives to reduce patient movement during the procedure. Answer. Correct answer, A. Explanation. Reducing fluoroscopy time is the most effective strategy to minimize radiation exposure in angiography. Fluoroscopy time directly correlates with the amount of radiation the patient is exposed to, so limiting this time helps mitigate unnecessary radiation. Additionally, techniques such as collimation, low radiation settings, and maintaining the right distance can further reduce exposure, but reducing fluoroscopy time remains the most immediate and effective approach. Radiation safety protocols are designed to follow the ALARA as low as reasonably achievable principle. Question 4. During the process of a percutaneous biopsy procedure, Dr. Lewis encounters an issue where the needle is not adequately reaching the target tissue due to anatomical challenges. What is the most appropriate next step for overcoming this difficulty? A. Apply more force to the needle to reach the target. B. Use ultrasound guidance to realign the needle. C. Increase the size of the needle for better tissue penetration. D. Change the target tissue to a more accessible site. Answer. Correct answer, B. Explanation. In situations where anatomical challenges impede the placement of a biopsy needle, ultrasound guidance is the most appropriate solution. It provides real-time imaging to realign the needle accurately with the target tissue, ensuring a safe and effective biopsy. Using more force or changing the needle size may lead to complications, while changing the target tissue may not always be feasible or advised. Depending on the clinical context, ultrasound guidance minimizes risks and enhances accuracy, reducing procedural complications. Question 5. In a modern context of endovascular stroke management, consider a patient who has suffered an acute ischemic stroke. What is the most important aspect of decision-making when determining whether to proceed with a mechanical thrombectomy? A. The presence of a large vessel occlusion in the anterior circulation. B. The patient's age and medical history of stroke. C. The time elapsed since symptom onset. D. The results of the patient's latest MRI scan. Answer. Correct answer A. Explanation. The most important aspect of deciding to proceed with mechanical thrombectomy is the presence of a large vessel occlusion (LVO) in the anterior circulation. Recent clinical guidelines indicate that patients with acute ischemic stroke due to an LVO, particularly in the middle cerebral artery or internal carotid artery, can benefit most from mechanical thrombectomy, especially if performed within a defined time, typically up to 24 hours from symptom onset. The patient's medical history and imaging results are important, but the presence of an LVO is the determining factor for the procedure's effectiveness. Question 6. The question remains whether the management of gastrointestinal bleeding through interventional radiology is superior to traditional surgical approaches. A patient presents with an upper gastrointestinal bleed. After unsuccessful endoscopic treatment, an interventional radiologist opts for embolization. What is the most critical consideration before proceeding? A. Ensuring that the bleeding source is in the vascular system. B. Ensuring that the patient is fully awake and cooperative. C. Ensuring that the patient has not had previous embolization in the area. D. Ensuring the availability of a surgical team on standby. Answer. Correct answer A. Explanation. In cases of gastrointestinal bleeding, interventional radiology procedures such as embolization are only appropriate when the bleeding source is within the vascular system. This includes arterial hemorrhages such as those caused by peptic ulcers or varices. The decision to proceed with embolization must be based on imaging that confirms the bleeding source is vascular, and it is critical that the interventional radiologist this information before embarking on the procedure. Having a surgical team on standby is good practice, but does not replace the need for appropriate diagnosis. Question 7. Under the assumption that a patient with chronic venous insufficiency is undergoing venous stenting and angioplasty, what factor is most crucial for the long-term success of the procedure? A. The stent must be made of a biocompatible material. B. The stent must be flexible to accommodate leg movements. C. The stent must cover the entire length of the venous obstruction. D. The stent must be coated with a drug to prevent restenosis. Answer. Correct answer. C. Explanation. The most crucial factor for the long-term success of venous stenting and angioplasty in chronic venous insufficiency is the complete coverage of the venous obstruction. Ensuring that the stent spans the entire obstructed segment is key to preventing restenosis and promoting optimal blood flow. While the stent material and drug coatings may provide benefits such as biocompatibility and reduced restenosis risk, adequate coverage of the obstruction is essential for preventing future complications. Question 8. In terms of radiation physics in interventional radiology, a patient is being prepared for a thoracic aortic aneurysm repair. The interventional radiologist must carefully balance radiation dose and image quality. Which technique is most effective in achieving this balance? A. Increasing the frame rate of fluoroscopic images. B. Using pulse fluoroscopy at a low dose rate. C. Reducing the beam collimation to focus on the aorta. D. Employing higher fluoroscopic power settings to improve image clarity. Answer. Correct answer B. Explanation. Pulse fluoroscopy at a low dose rate is the most effective technique for balancing radiation dose with image quality. This method allows for high quality imaging while minimizing the radiation exposure to the patient. By pulsing the fluoroscopic beam, radiation is delivered in discrete bursts, which reduces overall exposure without significantly compromising the image quality required for accurate procedure. Guidance. Increasing the frame rate or power settings would increase radiation exposure unnecessarily, and reducing beam collimation may compromise image clarity. Question 9. When analyzing the potential complications of tumor ablation therapies, a patient undergoes microwave ablation for a liver tumor. What is the most significant risk associated with this procedure? A. Tumor seeding along the needle track. B. Hemorrhage from nearby vessels. C. Incomplete tumor destruction due to insufficient heat. D. Damage to surrounding organs due to heat dissipation. Answer. Correct answer, D. Explanation. The most significant risk in microwave ablation MOE is a potential damage to surrounding organs due to heat dissipation, while tumor seeding and incomplete destruction are concerns. The heat undue and inadvertently affect neighboring structures like the diaphragm, bowel, or major blood vessels. Careful planning and monitoring are required to avoid thermal injury to these areas, hemorrhage, and incomplete ablation. Also risks, but are less significant in the context of careful technique and patient selection. Question 10. Throughout the course of an interventional radiology procedure, consider a patient who is being treated for a dural arteriovenous fistula F. The interventional radiologist must decide on the optimal embolization technique. What is the primary factor in choosing between liquid embolic agents and coils for AF embolization? A. The location of the fistula within the dura. B. The patient's age and ability to tolerate a catheter. C. The size and shape of the fistula. D. The cost and availability of the embolization materials. Answer. Correct answer. C. Explanation. The size and shape of the fistula are the primary factors in deciding between liquid embolic agents and coils. Liquid embolics are preferred for large or complex AFs as they can more effectively fill and occlude irregularly shaped vessels. Coils are often used for smaller, more localized fistulas. While the location within the dura and patient factors are important, the size and shape of the fistula directly influence choice of embolization material for optimal closure. Question 11. Based on the information related to the management of deep vein thrombus (DVT), consider a patient who has been diagnosed with DVT in the popliteal vein. The interventional radiologist is considering catheter-directed thrombolysis to remove the clot. What is the most crucial factor for ensuring the safety and effectiveness of this procedure? A. The use of low-dose heparin during the procedure to prevent further clot formation. B. Ensuring proper catheter placement and aspiration of the thrombus. C. Using higher flow catheters to accelerate thrombolysis. D. Determining the patient's coagulation profile and ensuring no active bleeding risk. Answer. Correct answer, D. Explanation. Before proceeding with catheter-directed thrombolysis, it is essential to assess the patient's coagulation profile. Patient with an abnormal coagulation profile or active bleeding risks may be at higher risk for complications such as bleeding or thromboembolism during the procedure, while low-dose heparin, proper catheter placement, and using higher flow catheters can aid the thrombolysis process, the most critical step. Ensuring the patient is at safe risk level for the procedure, focusing on coagulation and bleeding risks. Question 12. The implications of contrast media usage in interventional radiology are especially important when treating patients with renal impairment. For a patient with mild chronic kidney disease (CKD), what is the most appropriate recommendation to minimize the risk of contrast-induced nephropathy (SIN) during an angiography procedure? A. Administer the lowest dose of contrast possible. B. Use non-ionic low-osmolar contrast agents. C. Prehydrate the patient with isotonic fluids. D. Perform the procedure without contrast if feasible. Answer. Correct answer. C. Explanation. Prehydration with isotonic fluids, such as saline, is the most effective method for minimizing the risk of contrast-induced nephropathy (SIN) in patients with chronic kidney disease (CKD). Hydration helps flush the kidneys, preventing the toxic effects of contrast agents, while using a low-osmolar contrast agent and administering the lowest dose of contrast are important. Prehydration reduces the risk of SIN by enhancing renal perfusion and increasing the excretion of contrast. Question 13. In light of recent developments regarding vascular stenting in peripheral artery disease (PAD), a patient with critical limb ischemia is considered for angioplasty and stenting in the femoral artery. What is the most significant factor influencing the long-term success of the stenting procedure? A. The patient's age and comorbid conditions. B. The length and location of the arterial lesion. C. The type of stent used, bare metal versus drug-eluting. D. The degree of collateral circulation in the affected limb. Answer. Correct answer. B. Explanation. The length and location of the arterial lesion play a crucial role in the long-term success of stenting in patients with peripheral artery disease (PAD). Lesions that are long or located in high-tension areas may be more prone to restenosis, while age, comorbid conditions, and the type of stent used are also important factors. The lesion's characteristics must be carefully considered as they determine the technical feasibility of stenting and the potential for restenosis. Question 14. Considering the evidence on intravenous laser therapy EVL for varicose veins, a patient presents with symptomatic varicose veins and is a candidate for treatment. What is the most significant advantage of EVLT over traditional surgical stripping? A. EVLT offers faster recovery times and fewer complications. B. EVLT provides a more permanent solution to varicose veins. C. EVLT is less expensive compared to other treatment modalities. D. EVLT is only effective for superficial venous insufficiency. Answer. Correct answer A. Explanation. One of the most significant advantages of intravenous laser therapy EVLT over traditional surgical stripping is its faster recovery time and fewer complications. EVLT is minimally invasive, requiring only small incisions, and it can be performed as an outpatient procedure. This reduces the risks associated with general anesthesia and hospitalization that are present in traditional surgical methods. EVLT can treat both superficial and deeper veins, making it more versatile, but its primary benefit remains its minimally invasive nature and quick recovery time. Question 15. When considering ultrasound-guided procedures in interventional radiology, a patient presents for a biopsy of a renal mass. The interventional radiologist uses ultrasound guidance to guide the needle to the target area. What is the most important factor in ensuring accurate needle placement during this procedure? A. The angle of the needle relative to the skin surface. B. The patient's level of hydration and urine output. C. The use of contrast media to improve needle visualization. D. Continuous real-time imaging to guide the needle's position. Answer. Correct answer D. Explanation. The most important factor for accurate needle placement during an ultrasound-guided biopsy is continuous real-time imaging. This ensures that the needle is precisely directed to the target tissue and any adjustments can be made during the procedure. Ultrasound guidance allows for immediate visualization, ensuring proper needle trajectory, and avoiding complications such as puncturing adjacent organs. While other factors such as needle angle and hydration may be relevant, real-time imaging provides the greatest accuracy. Question 16. The growing trend in endovascular stroke management emphasizes the importance of timely intervention. In a patient who presents with acute ischemic stroke due to a large vessel occlusion (LEO), what is the most critical time window for mechanical thrombectomy to be effective? A. Within 6 hours of symptom onset. B. Within 12 hours of symptom onset. C. Within 24 hours of symptom onset. D. The timing is not critical as long as the patient is within the treatment center. Answer. Correct answer A. Explanation. The most critical time window for mechanical thrombectomy to be effective is within 6 hours of symptom onset. Recent clinical trials and guidelines have demonstrated that mechanical thrombectomy is most effective in improving patient outcomes when performed within 6 hours. Although thrombectomy may still be beneficial beyond this window, the highest likelihood of a positive outcome is achieved within this critical time, particularly in patients with large vessel occlusions. Question 17. Taking into account radiation safety protocols in interventional radiology, Dr. Wilson is performing a complex angioplasty in the abdominal aorta. Which of the following is the most effective method to minimize radiation exposure to both the patient and the staff during this procedure? A. Using lead aprons and thyroid shields for all personnel in the room. B. Increasing the fluoroscopic frame rate to reduce procedure time. C. Keeping the fluoroscopic field as small as possible and using collimation. D. Placing the radiation source as close as possible to the target area. Answer. Correct answer C. Explanation. The most effective way to minimize radiation exposure is to keep the fluoroscopic field as small as possible and use collimation. This technique limits unnecessary radiation exposure by focusing only on the area of interest. Using lead aprons and thyroid shields is also important for protecting staff, but collimation is the primary method for minimizing radiation exposure to both the patient and staff. The procedure, increasing fluoroscopy frame rate and placing the radiation source close to the target, can inadvertently increase exposure. Question 18. The underlying principle of tumor ablation therapies, such as radiofrequency ablation (RFA), is to destroy tumor tissue through heat. In the case of a hepatocellular carcinoma (HCC), what is the most important factor in determining whether RFA will be successful? A. The size and location of the tumor. B. The patient's liver function and cirrhosis status. C. The type of RFA device used, monopolar versus bipolar. D. The presence of collateral damage to surrounding tissue. Answer. Correct answer A. Explanation. The most important factor in determining the success of radiofrequency ablation RFA for hepatocellular carcinoma (HCC) is the size and location of the tumor. RFA is most effective for small tumors located in easily accessible regions of the liver. Tumors larger than 3-5 centimeters or those in difficult-to-reach areas may not respond as well to RFA, while liver function and cirrhosis status are important considerations for overall patient management. The size and location of the tumor directly impact the feasibility and success of RFA. Question 19. The correlation between endovascular management of trauma-related hemorrhage has gained increasing attention. A patient with a gunshot wound to the abdomen presents with severe internal bleeding. The interventional radiologist is considering embolization of the bleeding vessel. What is the most critical step in ensuring the procedure's success? A. Using a high-flow catheter for faster embolization. B. Identifying the exact site of bleeding using angiography. C. Administering preemptive antibiotics to prevent infection. D. Ensuring the patient is adequately sedated and pain-free. Answer. Correct answer B. Explanation. The most critical step in the success of embolization for trauma-related hemorrhage is accurately identifying the site of bleeding using angiography. Angiography is essential to pinpoint the exact location of the hemorrhage, ensuring that embolization targets the correct vessel, while using a high-flow catheter and providing sedation are important. Identifying the bleeding site is paramount for effective embolization and controlling the hemorrhage. Question 20. From the perspective of managing cerebral venous thrombosis, a patient presents with symptoms suggestive of this condition. The interventional radiologist must decide whether to perform a venous thrombectomy. What is the most significant factor in deciding to proceed with thrombectomy? A. The size and location of the venous clot. B. The patient's age and comorbid conditions. C. The availability of neurologist for consultation. D. The patient's response to anticoagulation therapy. Answer. Correct answer A. Explanation. The most significant factor in deciding to proceed with venous thrombectomy for cerebral venous thrombosis is the size and location of the venous clot. Large or centrally located clots that are not responsive to anticoagulation therapy may require mechanical thrombectomy to prevent severe complications such as venous infarction or brain damage. Although the patient's age and comorbidities are relevant, the characteristics primarily dictate the need for intervention. Question 21. In the context of principles of image-guided interventions, consider Dr. Anderson preparing to perform a liver biopsy on a patient with a complex hepatic lesion situated perilously close to both the hepatic artery and the portal vein. The patient's slightly elevated body mass index further complicates the procedure as it may obscure lesion visualization and alter the expected needle trajectory. Dr. Anderson must plan the intervention by selecting the most appropriate imaging modality that not only offers high spatial resolution but also provides dynamic, real-time guidance to avoid vascular injury and ensure adequate lesion sampling. This planning requires balance between diagnostic yield and patient safety, considering the risks associated with inadvertent vascular puncture and hemorrhage. What is the most critical factor in planning intervention? A. Choosing smaller needle gauge to minimize tissue trauma. B. Utilizing an imaging modality that provides real-time visualization of both the lesion and adjacent vascular structures. C. Scheduling the procedure during off-peak hours to reduce potential patient movement. D. Administering prophylactic antibiotics to prevent post-procedural infections. Answer. Correct answer B. Explanation. Real-time visualization is paramount in image-guided interventions, especially when critical vascular structures lie close to the target lesion. Utilizing modalities like real-time ultrasound or CT fluoroscopy ensures that the radiologist can dynamically adjust the needle trajectory, reducing the risk of vascular injury, while selecting an appropriate needle gauge and scheduling considerations are important. Do not compensate for the critical need to continuously monitor the spatial relationship between the lesion and surrounding vessels. This approach aligns with established interventional radiology guidelines, which emphasize patient safety and procedural accuracy. Question 22. With respect to radiation physics and safety in interventional radiology, Dr. Wallace is tasked with performing a complex CT-guided intervention on a patient requiring precise targeting of a deep-seated abdominal lesion. Given the patient's history of multiple prior imaging studies and the potential cumulative radiation dose, Dr. Wallace must optimize the CT parameters to minimize radiation exposure while ensuring adequate quality for accurate needle placement. This situation requires balancing the dose with diagnostic efficacy, incorporating techniques such as dose modulation and iterative reconstruction. What is the most effective technique to minimize radiation exposure during this intervention? A. Increasing the tube voltage to shorten the exposure time. B. Using fixed high-dose protocol throughout the procedure. C. Implementing dose modulation along with iterative reconstruction algorithms. D. Performing the procedure without any contrast media to reduce scan time. Answer. Correct answer. C. Explanation. Dose modulation and iterative reconstruction techniques are critical in reducing radiation exposure without sacrificing image quality. Dose modulation adjusts the radiation based on the tissue's attenuation, while iterative reconstruction improves image clarity at low doses. This strategy adheres to the ALARA, as low as reasonably achievable, principle in radiological practice. Options such as increasing tube voltage or using fixed high-dose protocol would likely increase exposure, and avoiding contrast does not directly affect the radiation dose from CT imaging. Question 23. Through the lens of patient selection and pre-procedural evaluation, imagine Esther Jackson, a 68-year-old patient with a history of coronary artery disease and diabetes, being evaluated for endovascular aneurysm repair (ABR) due to an infrarenal abdominal aortic aneurysm. His pre-procedural workup reveals borderline renal function and moderate arterial tortuosity, which could complicate catheter navigation. Interventional radiologist must decide if Esther Jackson is an appropriate candidate for ABR or if alternative strategies are required. What is the most crucial element in pre-procedural evaluation for selecting this patient for ABR? A. Assessing the aneurysm size alone. B. Confirming the presence of collateral circulation. C. Evaluating the patient's overall functional status and comorbid conditions. D. Assessing vascular access feasibility and arterial anatomy in detail. Answer. Correct answer. D. Explanation. Detailed evaluation of vascular access feasibility and arterial anatomy is essential when considering ABR. For Esther Jackson, the arterial tortuosity and borderline renal function require careful imaging assessment to ensure that the endovascular devices can be safely navigated to the aneurysm site. While overall functional status and comorbid conditions are important, the technical success of ABR depends on the vascular anatomy. This comprehensive pre-procedural evaluation is consistent with current guidelines and best practices in interventional radiology. Question 24. Based on the information regarding contrast media, types, usage, and adverse reactions, consider Dr. Ramos preparing to perform embolization on a patient with a known history of contrast allergy and mild renal impairment. The patient presents with a vascular lesion that demands precise localization and embolization, but the allergy history complicates the choice of contrast agent. Dr. Ramos must balance the need for high-quality imaging with the risk of adverse reactions. What is the most critical strategy in this scenario to safely administer contrast media? A. Pre-medicate the patient with steroids and antihistamines prior to contrast administration. B. Use a higher osmolar contrast agent to ensure better lesion delineation. C. Avoid any contrast media and rely solely on ultrasound guidance. D. Increase the contrast dose to shorten the overall procedure time. Answer. Correct answer. A. Explanation. Pre-medication with steroids and antihistamines is the recommended strategy for patients with a known contrast allergy. This prophylactic measure reduces the risk of an allergic reaction, enabling the safe administration of contrast media. High osmolar contrast agents and increased doses can heighten the risk of adverse events, and relying solely on ultrasound may not provide the necessary imaging detail for vascular lesions. This approach is consistent with established guidelines for managing patients with contrast allergies. Question 25. In a modern context of ET at MRI and interventional radiology, Optally is planning a radiofrequency ablation (RFA) procedure for a patient with a centrally located hepatocellular carcinoma (HCC). The tumor is situated near major bile ducts and vascular structures, making precise targeting imperative to avoid collateral damage. Optally must choose the optimal imaging modality for pre-procedural planning and intra-procedural guidance to ensure both the safety and effectiveness of the ablation. What is the most critical factor in selecting the imaging modality for this procedure? A. The cost-effectiveness of the imaging equipment. B. The modality's ability to provide high-resolution images with clear delineation of both the tumor and surrounding critical structures. C. The availability of the imaging modality in the interventional suite. D. The speed of image acquisition alone. Answer. Correct answer. B. Explanation. The ability to provide high-resolution images with excellent delineation of the tumor and adjacent critical structures is paramount when planning an RFA procedure near vital bile ducts and vascular structures. This ensures that the ablation is precisely targeted, minimizing collateral damage and preserving surrounding healthy tissue. While cost and availability are practical considerations, they must be secondary to ensuring quality and safety of the imaging guidance as endorsed by current interventional radiology standards. Question 26. Considering the evidence in angiography, techniques and interpretation, Dr. Patel is evaluating a patient with critical lower limb ischemia due to peripheral arterial disease. The patient presents with multiple occlusions and stenotic segments throughout the femoral and popliteal arteries. Dr. Patel must perform diagnostic angiography to determine the precise locations and extents of the lesions. What is the most critical factor in the interpretation of angiographic images that will directly influence the subsequent treatment strategy? A. The patient's cholesterol levels and lifestyle factors. B. The selection of the contrast agent used during the procedure. C. Accurately determining the location, length, and severity of each lesion. D. The time of day when the angiography is performed. Answer. Correct answer. C. Explanation. Accurately determining the location, length, and severity of arterial lesions is critical in angiographic interpretation. This detailed assessment informs the selection of appropriate therapeutic interventions, such as balloon angioplasty, stenting, or bypass surgery. While patient factors and contrast agent choice are important, they do not replace the essential need for precise lesion characterization, which is found for successful revascularization strategies in patients with peripheral arterial disease. Question 27. Under the assumption that balloon angioplasty and stenting are being considered for a patient with symptomatic peripheral arterial disease, Optochen is evaluating a 62-year-old patient with lifestyle-limiting claudication and a focal, yet moderately calcified, lesion in the superficial femoral artery. The decision to proceed with either angioplasty alone or combined stenting depends on several factors, including lesion morphology and compliance. What is the most critical factor influencing the long-term success of balloon angioplasty and stenting in this scenario? A. The patient's willingness to adhere to lifestyle modifications post-procedure. B. The immediate post-procedural improvement in blood flow metrics. C. The calcification degree of the lesion and the vessel's compliance. D. The choice of sedation used during the procedure. Answer. Correct answer. C. Explanation. The degree of calcification of the lesion and the vessel's compliance are the key determinants of the long-term success of balloon angioplasty and stenting. Calcified lesions may not dilate evenly, leading to suboptimal stent expansion and increased risk of restenosis. An understanding of the lesion's morphology and vessel wall properties is crucial for procedural planning and for selecting the appropriate device consistent with current vascular intervention guidelines. Question 20. When faced with thrombolysis and thrombectomy procedures, consider a scenario where Dr. Martinez is treating a patient with an acute ischemic stroke due to a large vessel occlusion. The patient presents within A short time window from symptom onset and rapid revascularization is critical. Dr. Martinez must decide between chemical thrombolysis and mechanical thrombectomy based on various patient and clot characteristics. What is the most critical factor in deciding to proceed with mechanical thrombectomy in this acute setting? A. The time elapsed since the onset of symptoms. B. The patient's baseline neurological status. C. The clot composition and its location within the cerebral vasculature. D. The availability of intensive care support post-procedure. Answer. Correct answer A. Explanation. The time elapsed since the onset of symptoms is the most critical factor in acute ischemic stroke management. Mechanical thrombectomy is most effective when performed within a narrow time window, typically within 6 hours of symptom onset, though select patients may benefit up to 24 hours, while clot composition, location, and the patient's neurological status are important. Timely intervention is paramount. Reducing permanent neurological deficits and improving outcomes are supported by current stroke management protocols. Question 29. In the context of embolization techniques for trauma and hemorrhage, Dr. Garcia is confronted with a patient who has sustained a high-energy pelvic fracture from a motor vehicle accident. The patient is hemodynamically unstable due to active bleeding from multiple pelvic vessels. Dr. Garcia must perform an urgent embolization procedure to control the hemorrhage. What is the most critical step in ensuring the success of the embolization procedure in this high-risk scenario? A. Using a standardized embolic material for all trauma patients. B. Administering blood transfusions prior to the procedure. C. Precisely localizing the bleeding vessel through selective angiography. D. Initiating prophylactic antibiotics to prevent post-procedural infection. Answer. Correct answer. C. Explanation. Precisely localizing the bleeding vessel via selective angiography is essential for a successful embolization in trauma cases. Accurate identification of the hemorrhage source enables targeted embolization, which is critical for controlling bleeding in hemodynamically unstable patients. While other supportive measures are important in overall patient management, the immediate success of the procedure depends on correctly identifying and embolizing the culprit vessel in line with trauma and interventional radiology best practices. Question 30. Considering the unique challenges in pediatric vascular malformations, Dr. Nguyen is evaluating a 10-year-old patient with a complex congenital vascular malformation involving both superficial and deep structures of the left extremity. The malformation has been causing significant pain and functional limitations. Dr. Nguyen must decide on the most appropriate interventional approach, balancing the need for effective treatment with the risk of damaging growing tissues. What is the most critical factor in determining the optimal treatment strategy for pediatric vascular malformations in this case? A. The overall size of the malformation relative to the limb. B. The patient's age and growth potential. C. The aesthetic outcome as prioritized by the family. D. The malformation's flow dynamics and its relationship to surrounding tissue structures. Answer. Correct answer. D. Explanation. The flow dynamics of the malformation and its relationship to adjacent tissue structures are crucial in determining the optimal treatment strategy for pediatric vascular malformations. Understanding whether the malformation is high flow or low flow, as well as its anatomical relationships, guides the choice between embolization, sclerotherapy, or surgical intervention. While the patient's age and aesthetic outcomes are also important, they do not directly influence the technical success and safety of the interventional procedure. Current pediatric interventional radiology guidelines emphasize the importance of detailed hemodynamic, anatomical evaluation to minimize complications and ensure effective treatment.